Hello, everyone. I'm Ron Rolfing, and I'm the Preferred Vendor Coordinator here at ACAP. And I'd like to welcome you to our latest ACAP Vendor Education Series webinar presented by Drummond Group. Our presenters today are Timothy Bennett, Director of Strategic Healthcare Initiatives, and Serena Mack, Program Administrator, both with Drummond. They will be presenting the webinar, Roadmap for Compliance to CMS Interoperability and Patient Access Final Rule. But before I turn it over, I do have a few housekeeping items I need to take care of. This webinar, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines. And these guidelines can be viewed on our website. We will be recording today's call, and we will post the slide deck and recording on our website by tomorrow morning. And the link to these items can be found in the invitation sent to you for this webinar. And please remember, if your plan is looking for a vendor, be sure to check out our list of preferred vendors on our website. Just look to the top of our homepage and click on the preferred vendors link. And of course, during the call, you can ask a question at any time. You can do this by clicking the Q&A icon at the bottom of your Zoom window and typing in your question. And all questions will be answered at the end of the presentation. Now, I'll pass it over to Timothy and Serena.
Thanks, Ron. So I just want to mention here as we kind of get started that Serena and I, we feel very, honored to have a chance to share some things with the ACAP membership that we're passionate about. I'll say that, back in late October, as a relatively new ACAP preferred vendor, I had the opportunity to attend my very first ACAP summit. And I mentioned this several times to some various of the ACAP leadership, but I was so very impressed with the passion that many and most of the health plans there, as they presented some of the projects and initiatives they were working on, and the things that they were doing for their membership. I was just really impressed with the heart and the passion that came across, from the membership, and it was very infectious for me. I came back from that really energized and with my own renewed purpose of, helping lead Drummond Group in our own way of how we can help improve patient outcomes as mainly a testing and certification body of health IT, but also focused on helping develop standards and promoting them, and helping to ensure that that there are interoperable and compliant healthcare health IT in the real world. So again, just really excited to share today. Next slide, please, Yoko. So for today's talk, I'm going to focus on the testing, my part of the talk today. I'm going to focus on the testing and certification of FHIR technology, mainly in the context of ONC and CMS as government federal regulatory bodies, their final rules, their proposed rulemaking on patient and provider access to health information using FHIR technology. I'll kind of speak towards sort of a high-level roadmap that I suspect all payers and their journey towards compliance to the Fed regs have, and perhaps how Drummond service offering and some of our perspective can assist the payers in this journey. A little bit later, my colleague Serena will speak on a couple of standards development initiatives that Drummond facilitates, including privatized patient data, consent to share, and the capture and exchange of social determinants of health data. So we're going to kind of give you a 2-for-1 today, if you will. But first, I'll take a couple of minutes here. I'll give just a brief introduction of Drummond Group, since we're kind of new to the preferred vendor group, for those of you that perhaps are not as familiar with our organization. So from the very beginning of Drummond Group in the late 90s, our mission has always been to promote standards, particularly around the secure exchange of information and interoperability in the marketplace among the implementers of those standards. Drummond played a key role in the early days, and by the early days, I'm talking about the early days of the 2000s, in the development and testing of some of the foundational standards that are now sort of ubiquitous as the industry sort of transitioned, all kinds of industry, transitioned from using private networks to exchange data to using the internet for these secure data exchanges. And so these standards that we worked on and promoted and tested interoperability for were things like encryption and digital signatures, identity, and using HTTP protocols to, transmit this data over the wire. All of these things are now sort of ubiquitous and are given in our modern protocols, that we that we use. So, back then the standards that we were testing were that Drummond backed and did interoperability certification, where they were adopted in supply chains by giants like Walmart and financials like the Australian and European governments, many other verticals, as they, like I said, sort of transitioned, to using the internet instead of paying for, access to these sort of virtual private networks that had been, in place before that. But in the past decade, Drummond has focused on healthcare standards and interoperability space as a leading ONC accredited test lab and authorization body. We'll get into a little bit more about ONC and their certification program, but Drummond's been part of that since the very beginning in 2010. And we've logged over 80% of ONC certified health IT products and applications, countless developers helping them understand emerging healthcare standards and federal regulation requirements. So having a market share like that is, we're very grateful for that. But that, that's just a testament to, at our heart, we just want to, help people understand, how to navigate standards and be good citizens in the real world. Next slide, please. So, this slide sort of depicts a little bit about all the sort of different testing and certification ventures Drummond Group is part of in the healthcare space. Things like, immunization records and working with some of the DEA final rules on audits of, systems that order or prescribe controlled substances. We have a pediatric EHR certification program and, patient privacy, and of course, emerging fire standards show that sort of Drummond certified products are, they sort of permeate throughout the care continuum, all with the goal of, helping improve patient outcomes. We also have a technology partner that we particularly use on the fire side of our testing, a company named Aegis. They also have a long history of building and developing testing tools to support many, health data interoperability initiatives. And we're very excited and fortunate with our business partnership with Aegis and their Touchstone fire testing platform. That sort of serves at the core of the testing and certification that we do around the fire standards. So, we feel that with Drummond's long history and experience in doing certification and interoperability testing, and then with fine tools like we have from Aegis, we believe we have unique service offerings that holds a great value to, all kinds of folks in the healthcare arena, including the payer community, helping to mitigate their compliance risks, especially now here recently in the fire solution platform. Yoko, next slide, please. So to kind of wrap this sort of introductory of Drummond Group up, I do want to mention that back in January, about this time last year, we were, January 2021, Drummond Group launched a new testing and certification program specifically aimed at the fire APIs that were called out in CMS Patient Access Interoperability Final Rule. And like I said before, you know, it uses the, you just touched on, fire testing platform. Helps us verify products and solutions that are compliant with the fire standards that are, you know, demanded now by federal regulations. Purchasers and buyers of these technology solutions can access Drummond's list of certified products with, you know, transparent visibility into what we have tested, what these products have implemented, what they've been tested on. And, you know, it just gives, you know, buyers a, you know, a peek into, you know, what these products are, you know, are actually, you know, claiming compliance for. You know, with that, Drummond certification sort of provides payers and other, you know, health IT entities an alternative to an otherwise sort of unsubstantiated claims of compliance, you know, to fire and security specifications. So enough of that. Let me sort of get into, you know, the meat of my talk today, which is, you know, talking about these fire standards and what they mean to the payer community and other aspects of health IT. So just so everyone, you know, we're all on the same page. FHIR stands for the Fast Healthcare Interoperability Resources, and you know, it's a secure data exchange protocol that offers healthcare, you know, its best hope, I think, at least to date, for interoperable data and security specifications. It uses sort of technology that you would find, you know, scattered throughout, you know, some of your other online experiences of shopping or, you know, movie watching, TV binging, you know, all of those, you know, internet applications that are, you know, becoming, you know, permeated, you know, throughout our, you know, everyday lives. FHIR sort of uses some of those, you know, same, you know, technologies under the cover. They're tried and true, and they have a strong, you know, security underlying. But of course, you know, the big thing of FHIR is how it standardizes health information in a way that, you know, no matter what system you are, if you understand and know the FHIR specs, you should be able to access patient data and understand it in a common and way. And so this list here that I've got just sort of gives a little bit of an overview of some of the use cases that CMS is working towards and trying to use FHIR to address, you know, things like payer to payer and payer to provider data exchange, and having patients access all kinds of different parts of their health information. And as we'll see, you know, later, there's some, you know, future roadmaps for improving and reducing the costs and making prior authorization a lot more efficient, and you know, addressing, you know, other aspects of you know, of healthcare data exchange. Next slide, please. So I want to rewind a little bit to back to sort of a important moment in March of 2020. What I would say is sort of a watershed moment for the emerging of FHIR standards, when both the ONC and the CMS, which I kind of call these two wings of the HHS bird, they were on the same day published their own sets of final rules that had FHIR implementation requirements in there for EHRs and providers, and then also for payers in the sense of the CMS. For ONC, their 21st Century Cures Final Rule established requirements for EHRs and their provider users to expose FHIR APIs so that patients could access their clinical data through open market of innovative smartphone apps, web browser apps, and also ONC was, you know, making requirements of EHRs to also expose APIs so that providers could also use, you know, apps like that to access populations of patient data as well. On the CMS side, their patient access and interoperability final rule established requirements for payers to expose similar FHIR APIs so that their health plan members could access their clinical data that the that their payer knows about, and their EOB and claims data, and their drug formulary data as well. Also through a vision of eventual innovative smartphone apps and web browser apps as well. And then also sort of establishing a way that health plan members, as they transition from one health plan to another, can give permission or consent to their new health plan to go back to their old one and pull their data forward so that they can maintain a longitudinal health record with their new health plan. And all of that, the vision there is using FHIR technology. Next slide, please. So just a couple of words here. So the publication of these two final rules back in March 2020, again, one each from the ONC and the other from CMS, really showed that both agencies were collaborating, working together lockstep around a national strategy for interoperable and standardized health data exchange and access. It's sort of been, the golden apple everyone's been pursuing for decades. FHIR is the, like I said before, perhaps the best hope for that. But I think furthermore, another notion has emerged, and one that, really, hit me very strongly when I began to, understand that and see that, as CMS, would talk about their vision of FHIR in the future. That it was more and more clear that the idea and the notion is that the payer and not the provider is the future repository of a patient's longitudinal health record. And, if you think about it, it sort of makes sense. I mean, a patient can travel around to, various different providers, hospitals, clinics, what have you. And, they could access their health information, through portals with each of these providers, but their data is kind of scattered around. But, sort of the single constant thing in the middle of all of that is, who's paying for the healthcare service, and that's the payer. And so it doesn't really, matter where you sort of travel around in the provider market, your data sort of ends up, back with the payer. And I think the future vision is, as more of the FHIR technology is implemented and deployed in the real world, you'll see more and more of that, provider clinical data and other data beginning to reside, in the payer space, and the payer playing a more critical central role in the view of a patient's full and longitudinal health record, which includes not just their clinical data, but obviously their claims data and other data as well. So next slide, please. Now, about a year ago, CMS published a second final rule. It didn't last very long, and part of it, I think, is rooted in some politics and maybe a step back thinking, with the new administration. But this final rule was pushed through rather quickly in the waning days of the Trump administration, and raised a lot of eyebrows, because if some of you guys are familiar with how federal regulation goes, sometimes it takes a long time for that to sort of work through, and this was almost a drag race. I was really amazed at how quickly this final rule got pushed back, and sure enough, as soon as the Biden administration came in, and they began to roll back some of these final rules that they got pushed through really quickly, and including this one. And so it's just sort of been on hold, administrative hold since then. But regardless, the things that were in this proposed final rule, and you can go on the CMS website and still see it. It's not like it never existed. It's still there. It's still in a proposed state. But this was a quite ambitious building on of their first final rule. calling out FHIR technology to address provider to payer data sharing, a significant re-architecture of the prior authorization infrastructure aimed at reducing both provider and payer burden and cost around the whole prior authorization workflow, and also some further FHIR requirements on payer data exchange. Next slide, please. So this slide is kind of a quick view of some of those regulatory deadlines that were to come, so to speak. Last July marked the deadline for payers to make available FHIR APIs for patient members to be able to access their clinical and claims encounter data, drug formulary data. And there were many health plans that met that deadline. Some haven't. Some can continue to do that. And I know CMS is sort of, working, through the payer community on how to get, everyone, exposing these first adoption of FHIR APIs. On the other hand, some other deadlines that they had in place, namely the one that should have just passed here with payer data exchange, and in the future, the prior authorization and burden reduction FHIR requirements. Those have been pushed out. Deadlines waiting for the rulemaking from CMS, so kind of in a little bit of a holding pattern there. Even ONC sort of pushed out their deadline for EHRs to implement FHIR, technology in the EHR world. But that deadline is coming at the end of 2022, and I think this year really promises to be sort of the year of FHIR, sort of making its debut really in the wild, in the real world, at least in the EHR space, in the provider space. And so test labs like Drummond Group and ourselves and others are really gearing up for FHIR provisioning in EHRs on a massive scale this year. And so I think that's that's something to look forward to. Next slide, please. So sort of complicating the FHIR adoption and implementation landscape here among EHRs and payers alike is the information blocking provision that went into effect from both ONC and CMS last April. The info blocking rules, they prohibit actors, various different actors in the health IT space, from sort of taking any kind of actions that would prevent the sharing of health data. And if you've been following, the health data world for as long as you can remember, probably, that patient data has been siloed and gatekept and, kept locked behind, locked doors and whatnot. And there's been a real mission from the federal government to sort of break down, these, info blocking culture, within healthcare. And so, there's the info blocking provision that, certainly has a lot of teeth, behind it to sort of break down those barriers. But, the takeaway from that is that, at least here in the FHIR space, the way that the info blocking rules are sort of set up now is that, someone who has a FHIR server, like a payer system or an EHR, they're really not allowed to refuse, a client application, a smartphone app or a web browser from, accessing their APIs. Now, I mean that in a sense where the data is not open. I mean, there's still, you still have to have authentication and authorization. But if you as a payer system knows that a certain client application is bad, it's not architected well, it may have integrity issues or even security issues, you really can't, according to the info blocking rules, say, I'm not going to let that client, connect to my APIs, and that's that causes across the board. There's a lot of concern around how those info blocking rules are applied, and so we certainly hope and expect further rulemaking around this kind of considerable concern, especially as we sort of set on the eve here of especially in the provider and EHR market of a lot of these APIs going live, and even in the payer community, these APIs have already went live in many systems back in July. So we'll see how that goes with the info blocking rules, but it's a legit cause for concern that the FHIR servers don't have much leeway there in that. Next slide. So the things we mentioned so far about FHIR are just the tip of the iceberg with respect to where federal rulemaking around FHIR API technology is heading. Last summer, with the CMS proposed rule for calendar year 2022 IPPPS, included in that proposed rule, there was an RFI from CMS that sought feedback and comments on CMS's plans to transition to a fully all digital quality measures infrastructure, in which FHIR plays a central role in the collection of measure data, as well as reporting that measure data, all by the year 2025. So that's a big signpost. That's a big, road sign, if you will, of where one place CMS is headed in the future with expanding, FHIR technology into other use cases more than what we, have talked about previously. Likewise, just this past Monday, ONC published their own RFI seeking comments and feedback on prior authorization standards and implementation specs. And in that RFI, they have heavily referenced the prior authorization work that CMS, put in their, proposal that's sort of currently on hold now. But, we can see some very strong signaling here by both CMS and ONC regarding, the future of the use of FHIR as key technology in quality measures and prior authorization. And so the fact of the matter is here, for both EHR developers, for providers, for payers, FHIR is a way of electronic and digital life. And without strong testing and certification, just our experience here at Drummond Group, we know that compliance and interoperability is difficult to obtain. If you don't have strong testing, strong certification, when you implement standards like this. So let me move on to sort of the last little part of my talk before I turn it over to Serena. So, sort of pivoting to FHIR testing the certification landscape, what does that sort of look like now? Well, on the one hand, ONC, has a decade-long established mandatory testing the certification program for EHR and health IT technology. Now that includes, with their Cures rule, FHIR, patient access, and population health services. So, though that certification program, as I mentioned before, is really going to be gearing up this year, to test and certify a lot of EHR's FHIR, implementation with regards to patient access to their data. And so, but as a result, providers and purchasers of EHRs, they really have a considerable confidence going into a buying or a purchasing decision on whatever system or solution that they choose. There's a high degree of expectation because of the certification program that whatever they decide to buy is going to be compliant, is going to be interoperable, because of that sort of strong certification and testing apparatus from ONC. On the other hand, CMS sort of chose a different road with their final rule around fire, choosing not to sort of implement a mandatory testing and certification program, by independent third-party parties like Drummond Group that ONC has done. Instead, they publish their rules, they publish their guidance, and just let the industry implement that and go down it like that. And so payers, I think, are sort of left in sort of a different space than perhaps providers are, in managing sort of a greater risk and perhaps less transparency and confidence when it comes to, purchasing, a fire server platform, to meet some of these regulatory needs. Next slide, please. And so, health plans, like, many other, users of fire technology, as you're subject to enforcement provisions that CMS might have for their rulemaking around fire, you sort of have your own, journey of compliance. But I think there's some common waypoints there. Each payer obviously sort of has been in or will be in a decision to, build or buy a solution, or maybe perhaps a mix of the two. But regardless of that choice, because there's not a strong mandatory certification program from CMS, there is a persistence of confusion on what it exactly means to be compliant to, the final rule and some of these fire implementation guides and standards. What's in scope for compliance? ONC sort of provides a lot of that kind of guidance for the EHR community, but that's mainly through their strong fire testing and certification, program. But sort of regardless of the outcome of this buy versus, build decision, each payer, I'm sure, will likely perform some form of testing of their implementation, whether you built it, whether you are buying it. And, the extent of your own testing that you perform, has some sort of correlation to, your risk mitigation. But then, what happens after your system is deployed and, in the real world? The next big question is how you as the payer sort of maintains compliance of that system over time. We all know software gets modified, changes over time. Certainly these fire implementation guides are somewhat immature. There's a lot of maturity left to go in some of these standards, and they're going to evolve over time, and sometimes rather quickly in these early days. And then we already have noted, CMS and ONC and others have, they're already signaling additional regulatory changes and other requirements down the road. So sort of the big takeaway here I want to kind of say is that compliance really isn't some one-time event that happens, but it's really an activity that should permeate every aspect of the life cycle of the system. And whether you're a provider or a payer or a developer, I think you need a strong support system to to help you along that journey that sort of has a destination, but maybe really continues to have a destination over and over again, as time goes on. Next slide, please, Yoko. And I think this will be sort of my last one before I, sort of wrap up and switch over to my colleague, Serena. I would like to take a moment, to kind of call out some fire solution developers that have taken a leadership of the market and have submitted themselves to voluntary third-party independent validation and certification of their fire servers, their solutions. These vendors recognize that the market benefits of certified products and the purchasers of their products have a higher level of confidence and a lower risk to, non-compliance. And, we at Drummond, we very much encourage the payer community to look for third-party, independent certification of your fire technology, when you're considering a buy decision. And if you've already, have a solution in place, then, we also encourage you to go to your vendor and suggest that they obtain a third-party independent, certification of their platform and their solution, so that, you can gain some, confidence that their product is actually compliant and interoperable. All right, so let's go to the next slide, and I'll kind of transition and switch gears from, my talk about FHIR and the standards and the landscape that exists today and in the future there. And let me bring on my colleague, Serena Mack. And let me reiterate this: from the very beginnings of our company, we have been focused on the development and promotion of standards. And, we want to share with the ACAP community some standards work that we are helping to facilitate. Some of this work that may be of interest to the health plans represented here today on this call. Serena is going to spend a few minutes talking about our work in the equitable interoperability space. And so what do we mean by equitable interoperability? Well, as you guys probably know, in our current healthcare ecosystem, individuals, patients, members, whatever, they must choose to share all or none of their health data. That's it's either all or none. And in some instances, this decision is made algorithmically by organizations or software, vendors seeking to comply with federal, state laws. And those patients, those individuals that have no personal health information that's deemed sensitive, whether by state law or social stigma or personal circumstance, they can share their data with a proxy or a third party application via existing exchange standards without concern. However, for those members of society that who may have sensitive personal information, sensitive aspects of their medical records, by having to share either all or none of this information, that could lead to them failing to receive the optimal health care and creating health care disparities. That interoperability is sort of all intended to facilitate equitable care. And so we recognize that privacy, consent to share, social determinants of health all have challenges and barriers to standardization, to interoperability, to equity of care. I know that these topics and concerns have a high interest among the ACAP membership. And Drummond wants to just take a moment here to share with you folks some external and collaborative ongoing work in these spaces that we hope that will bring about some future standardization that leads to some real improvements in patient outcomes. So Serena, I'll turn it over to you to share some of the work you've been involved in on behalf of Drummond and the folks that you work with.
Great. Thank you, Timothy. Our first topic of equitable interoperability is social determinants of health. Social determinants of health, or SDOH, has been a big buzz topic over the last few years, and I'd like to share just a little bit of what's in the works right now. As a background, you can see the CDC definition of social determinants of health on your screen. Things that we commonly think of as elements of SDOH are things like food insecurity or housing stability. But other examples that might not come to mind so readily include things like veteran status or loneliness. We know that all of these things have a significant impact on health outcomes. To date, SDOH information has not been fully defined or codified, and this has significantly impeded full person-centered healthcare, while also resulting in large silos of mostly unused data. Next slide, please. The Gravity Project was founded in 2014 and is a large public collaborative that is working under the HL7 umbrella. And they are focused on 3 aspects of SDOH information standard development. The first is in terminologies, where they are creating, reviewing, and submitting updates to a variety of value sets. The second is implementation, the data transfer of these SDOH codified elements. And lastly, they also lobby for the inclusion of SDOH interoperability in new healthcare policy decisions. Their membership is open to the public with twice monthly meetings. These meetings are very well attended and very informative. Their Confluence website has a wealth of information and resources if you are interested in learning more about what they are doing. Next slide, please. In very exciting news, their SDOH Fire implementation guide is very close to becoming finalized. It's currently up for ballot and has been tested in more than one Connect-a-thon, including the most recent one that happened earlier this month. This is important to the payer community because a complete full implementation of this guide could allow patients to access the SDOH information that their payer has on file, or payers could receive SDOH information from other payers or providers or other services. Once this implementation guide has been finalized, it is Drummond's intention to incorporate that within our voluntary programs, possibly even including it within the CMS payer testing and certification program that you heard a little bit about earlier. Gravity has also made several submissions to both ICD-10 and US CDI version 2. Some of those submissions have already been accepted and are ready for use. For those who don't know, the approval process for new codes is slow going. So these developments are already incredibly promising for what SDOH interoperability could look like in just a few years. Next slide, please. The second equitable interoperability topic, and dare I say the largest topic, is privacy. Patient privacy in healthcare is critical and has often been overlooked. It's commonly seen as a problem that is too large to tackle. We know that patients with complex healthcare needs or sensitive conditions are experiencing disparities of care. Patients might choose not to share relevant data in the fear that their data may be reshared without their consent or shared in a way that is unsafe. To add a little complexity, we heard earlier about the information blocking rules and the CMS Final Rule about payers having to share information with their members. So how do we tackle this? The Protecting Privacy to Promote Interoperability work group was established in 2020 to address privacy at the policy level while being supported by technology. PP2PI's goal is to really focus on the granular segmentation of data, allowing us to mark anything as private while being able to share that information according to the patient's wishes throughout the entire healthcare ecosystem, while also creating policy recommendations for a national implementation strategy. This is a completely volunteer work group that is not sponsored by Drummond or any other specific organization. Next slide, please. The Protecting Privacy to Promote Interoperability work group is actively looking for representation from the payer community, especially payers that have a dedicated focus in providing care to marginalized and at-risk communities. Our membership is open to the public. We have one monthly 1 hour-long meeting on the first Tuesday of the month, and the subgroups that you see on the right side of your screen meet separately throughout the month. The reason that Drummond is so invested in privacy projects really came about because of the work that we've been doing in our pediatrics development. Pediatrics is obviously an area with a lot of vulnerable populations, and as we move forward, it became really clear to us that without a comprehensive, granular privacy standard, that these same issues will just arise over and over again. You can have the best standard in the world, but if there is no standardized implementation or no drive for implementation, then adoption will always be minimal. Drummond believes that offering a certification program for both privacy and social determinants of health, that it will help drive implementation, best practice usability, and most importantly, patient trust in the healthcare industry. Next slide, please. As anyone who has done any work in privacy before understands, privacy is a complex concept that needs to be tackled from multiple angles in order to present any sort of comprehensive solution. PP2PI is very excited to work with the following organizations that also have a dedicated focus in privacy. Absolutely check these groups out if you are interested in furthering privacy work. The Stewards of Change Institute and Project Unify is working heavily on informed consent management tools. They are a Robert Wood Johnson Foundation grantee, and they just finished a very, very large project of an environmental scan of all of the different informed consent management tools that are in use across the country today. It's an incredibly comprehensive report. It also may give some ideas on ways to incorporate good tools within your own communities. The Health Relationship Trust, or HEART group, is focused on patient-controlled data sharing. They have an amazing proof of concept that I believe is ready for implementation. Nancy Lush has been spearheading that work group and is just really passionate about patients being in control of their own information. Next slide, please. I hope that I have given you some good information about what's happening in the upcoming future for both privacy and SDOH interoperability. The following links are here for if you'd like to get involved. I believe they are also in the chat for you. As I stated before, membership for PP2PI is open to the public. The link that's there will take you to our registration form, which will give you access to our meetings and our collaborative platform. If you'd like to check out our white paper or find more information, there is the Drummond Group website link. If you would like to get involved with Gravity, Stewards of Change, or HEART, the links are also there. This is truly a case where many hands make light work. So thank you for your time, and I will pass it over to Tim to wrap up.
Yeah, thanks, Serena. And also, if anyone has any, questions or wants any more information about fire testing and certification, its intersection with federal regulations, Drummond is here, to help and assist in any way we can. You can email me at timothy@drummondgroup.com or fire@drummondgroup.com. Either way. And we'd be happy to, to assist you in whatever way we can. And I think I've put those links in the chat as well. I think at this time, that concludes what we wanted to share with you folks today. And again, we're excited to have the opportunity. And, if there are any questions from the audience today, we're happy to see what we can do about answering them.
Okay, our first question. The current vendor certificates available show that none have been validated against claims and encounter data and patient clinical data. Does this indicate that they did not pass these certification tests?
I'm assuming the question here is in regard to Drummond's certification test. And so if that is the case, I'll just say this, those vendors are sort of in process of getting, tested and certified. I will say that we have recently had some vendors, test for claims and encounter data, also for patient clinical data, and those are going to be posted as certified soon. So, it's a journey for everyone. Let me just say that. And I'll say, I'll make this comment too, in working with some of these vendors that are, working towards getting tested and certified, some of these folks are early adopters, they're leaders in helping develop the standards. And, they're finding, testing and certification of their own products, is something that, is taking time because they're having to, also get their own products, up to snuff, so to speak. So, yeah. So anyway, I think you'll shortly see some vendors that are certified to those, to those IGs, the Karen from Blue Button, which is the claims and encounter data, and then the US Core, US CDI Smart on Fire implementation guides as part of patient clinical data. You'll see that very shortly.
Okay, one quick note. We've had a question saying, is the link in the Gravity project correct? It's spelled gravidity instead of just gravity. And they were just wanting to make sure if that was correct.
Yeah, that's probably not right.
Okay.
Looks like Serena is went ahead and posted the correct link there. So yeah, thanks for that catch.
Okay, our next question. How and when is CMS enforcing compliance to their rulemaking around fire implementation requirements for payers?
Well, that's sort of the $60,000 question, or I don't know, maybe $60 million question. I'm not really sure. I think at this point, the spirit behind CMS is not to be punitive. I think they want to, help, bring the market along with, the transition to fire. And I think they've already shown some, patience and some, working with the community towards it. So, I'm not sure, I'm not privy to, sort of what goes on behind the scenes at CMS in terms of their enforcement. I do know that CMS has said that the enforcement of these fire provisions will sort of be done at the program level. So Medicaid fee for service or, CHIP or whatever, they'll sort of have their own, compliance and enforcement, provisions as we go along. But I think at this point, the focus is really to help, payers and the payer community to get, implementations in place and work towards it. And I think as a general rule, I've seen that many times over the years with Fed regs. There's initially a period of time where there's, the carrot, sometimes there's incentives, sometimes it's, punitive enforcement is not there. But at some point in the future, you would expect that to, to kind of roll in, as has been the case, historically. When that will be, I'm not sure. So unfortunately, I can't really answer that question. I think that's a question we're all, wondering and considering. But I would just say at this point, the spirit is let's help folks sort of get on the road towards implementation and deployment.
Okay, our next question. If CMS isn't requiring certification of fire, then is testing and certification really necessary?
Well, that's kind of a philosophical question to some degree, I think. So, our experience at Drummond Group for 20 some odd years of doing interoperability testing and certification, sometimes with a, with a 600-pound gorilla, so to speak, mandating people to do it, whether that's a Walmart or whether that's ONC or, some other entity, or whether it's just a voluntary, buy-in from some, industry group. Without testing and certification, it's really, really hard to expect that there to be compliance and there to be interoperability. You can put a standard or a specification in a room with 10 different people, and you'll come away with 10 somewhat different implementations of that. everyone read the same standard, everyone, you know, and then everyone interprets, you know, parts of it differently. And that's where interoperability and compliance sort of, you know, jumps the track, so to speak. And without, you know, some sort of means to get everyone on the same page, testing to the same test, and, you know, understanding a common, you know, understanding of an interpretation of a spec, it's really hard to, you know, really fully realize the intention of the spec. And so, you know, whether there's a mandate or whether, you know, someone steps forward, whether it's an industry group or, you know, someone like Drummond Group with some of our services and says, look, you know, we'll, you know, we recognize that testing certification is important, and, you know, you don't have to come, but, you know, if you understand and realize the value of it, you know, like, you know, some folks in the industry do, then, you know, you'll have a better chance of realizing it. So, you know, that's the sort of the conundrum that you're in when you don't have a strong, you know, mandate for certification and testing. It ends up, you know, somewhat being a grassroots, and ultimately it'll get done. You know, there's the sort of hard way, and then there's the very, very, very hard way where, you know, interoperability happens over time at great cost, when everyone has implemented their own different systems and everyone is dealing with customer issues and things that don't work and people having to fix things, you know, on the fly. And, you know, that's, you know, there's different hammers, you know, to get there. One is hard and the other is extremely hard and costly. So, hopefully that helps.
Okay, next. In regard to persons interpreting the standards differently, how were the certification tests developed to ensure Drummond Group's understanding was the correct one?
Yeah, that's a great question. And certainly, you know, in the position Drummond Group is in, we don't want to sort of, you know, sort of say, well, you know, Drummond Group says this or Drummond Group says that, because first of all, we're not the experts in terms of writing standards, at least these fire standards. And so, you know, our partners and, you know, our involvement in this in the standards community, you know, we're here to help facilitate all the great work that other people have done. And so it somewhat takes a village, and that's our approach here. Is you know, we use test scripts and testing and testing apparatus that's, you know, been involved in connectathons and other forms of testing for a while as some of these standards have been developed. And we also, you know, I think a big thing that we're doing at Drummond Group is, even with our testing and certification program, we're forming a steering committee that will have voices from, you know, the whole stakeholder community. That would include, you know, folks that are involved in writing the standards and the specs, vendors that are implementing them, end users, you know, other folks that would help Drummond Group steer, you know, the testing and certification program, so that when inevitably there's questions about what is the correct interpretation of, you know, it's not Drummond Group saying this or that. There's a, you know, there's an informed, you know, governance that, you know, considers those questions and helps resolve interoperability issues. That's the approach we're taking. We feel that that's the right thing. You know, we have a real spirit of collaboration, and you know, we have no intention of, you know, of being the of trying to tell everyone what to do. That's a big mistake, and that's not what we're here about. So hopefully that helps. That's kind of our approach to how we're doing this in the absence of, you know, of a regulatory body, you know, making those decisions themselves. Okay,
well, it looks like that takes care of our questions. I want to thank everyone for taking time out of their schedule to join us. And I want to thank Serena and Timothy for a very informative webinar today. Just a reminder that the slide deck and recording will be posted on the ACAP website tomorrow morning. Thanks a lot and stay safe. Thanks.
Thank you so much. Bye.